So I'm here with Dr. Roger Spahr, MD. Hi, Dr. Spahr.
Hi there.
Dr. Ralph Waldo, MD.
Hello.
Hi, Dr. Waldo. We're going to go over why pushing folate is not the best idea with some individuals. Pushing high levels of folate is not a good idea with some individuals. So they're both going to go over this biochemical pathway graphic to explain that process. So take it away, either one of you. I don't care which one.
Well, I'll just start a little bit and once you finish up. So, most of us see that the MTHFR gene, it can have several different connotations, many different things it can do. There are two different loci in there. You have double comps. The whole thing about that is that 30% of the population will have double comps, and they're going to have difficulty with pushing through the pathways. If you give activated folic acid, you're going to have more activity here, and that's fine. But especially if you push higher doses of activated folic acid, as it goes through the cycles to reduce homocysteine, if it turns out that you have a CBS gene, as well, which can speed up then the activity through here, and then you have a slow SUOX gene SNP. Rather than to go through the pathways to create positive results with the alpha-ketoglutarate and the cysteine, it will instead throw off more ammonia. So your ammonia levels will go up. So patients will feel worse, they'll have more brain fog, they'll have more fatigue, and that's where a lot of that goes through. It also has to do with peroxynitrites as well. So Ralph, do you want to finish that up?
Yeah, and really what's happening is if you've got, there's two forms of that CBS enzyme that can be an issue. And you really want to watch for that. It's the person that you give the folate to and they get a backfire result, or they get fatigued, agitated, irritable, can't sleep, they may flush. So people with sulfur allergies, definitely be aware they're going to be there.
That's really good.
And so when we throw off more sulfites or we overwhelm the system, and the way I've heard it say is you're basically playing chess or playing a game of Russian roulette when you treat this. And what you want to do is you want to fine-tune the dose to the patient. So it's not that we don't want to treat, we want to treat, but we only want to treat to exactly what that patient needs, and we want to go at the lower levels. And if we do get it wrong, we are creating a toxin that then will offset and cause a bacterial overgrowth in the bowel. So we can actually do harm. Bacteria producing the ammonia, and what comes out of that then are things that we were just listening to at a conference we're at or hearing all about from Dr. Mercola, peroxynitrates, and your superoxide anions. Well, your peroxynitrates are a major issue when we get that, and can even nick up our DNA and cause mutations and put a real load on the system, so it backfires. So it really is all about a balance and getting it right. And if we get that balance right, we're going to get all our positive results, not make a patient miserable, and not have them then scrambling to stay away from all the sulfury foods that we need in our diet to keep us healthy too.
Yeah. So you believe then that the pushing folate above 1,000 micrograms is not a good idea, that keeping it moderate about 800 micrograms to 1,000 is probably where you need to keep it?
Yes, and we're throwing methyl groups to other places, but other enzymes, and worst thing we could do is overmethylate a person and start messing with things that in the body, DNA enzymes we do not want to turn on.
That's great.
And basically the short story to the patient is they may have read about methylation pathways and activated folic acid, but the part of being the good integrative physician is going to be when you talk to them, you say, by the way, this is something that could benefit you a lot based on your symptoms and based on your history and what we know so far if we have your genetics. However, if you get worse by taking this, that means most probably you're getting into these pathways. If they know that up front, and they know why you're using the low dose, and they know what to look for. Now, not only have you done a service to the patient, but you come up looking very, very smart. Because most of the time people wait until all of a sudden they get sick, and then they go, well, gee, why did you get sick? And they try to manipulate the dosing. Whereas if the patient is informed ahead of time that this is a possibility, now they're saying, wow, that doctor really has my best interest in heart, so I should stay seeing this doctor.
That's great. That's a great insight.
Well, tell your patient is either way, bad or good. It's a yes, we're dealing with this issue and we do want to deal with it, but we want to get it right.
Right. So really, in your estimation, a product like Methylcare would be much more therapeutic and a much more reasonable approach because of the levels of folate, but then it's combined with everything else, so you get a broader spectrum to address all these different pathways, but you're keeping the methylation, or I should say the folate levels, moderate so that you don't get into some of these over-methylation types of situations. Is that right?
Yeah, what I like about it, the dose of folate, and still can even say, gosh, if the 800's a bit much, we can come up with a nice way, or we say, hey, take half that dose initially. And the fact you guys have molybdenum in there too, which runs this enzyme down at the bottom as a cofactor for the SUOX that helps neutralize the excess sulfur.
That's awesome.
It's a smart product.
And there are some prescription activated methylfolate on the market.
Yep.
They are both higher dose methylfolates. One's 2,500 and one is, I think, 7,500.
Yeah.
Yeah, that's
75 milligrams.
75 and 15, I think, actually. 7,500 and 1,500. That is a lot.
It sure is.
And those people, I've seen those people, and they do get sick.
Yep.
A lot of them do get sick, yeah.
This is a great insight. Do I have your permission to share this? Yes?
Sure.
Yep, great. Thank you so much. That's really helpful.